So today I'm going to share how to overcome postpartum depression and anxiety so you can finally feel like yourself again, your brain and body feel balanced again after giving birth. I am Dr. Jaquel Patterson, a nationally recognized naturopathic physician and functional medicine expert. Postpartum mood disorders affect up to 1 in 5 mothers, yet many are told it's just the baby blues. It's not your fault. Your body and brain are going through massive changes, and understanding what's happening is the first step towards real healing. So why does postpartum depression happen and anxiety? So postpartum depression and anxiety are not just hormone swings. There are biological and systemic effects. And after birth, your body undergoes these dramatic changes. The first thing, your hormones drop, estrogen and progesterone plummet, cortisol dysregulation is disrupted. This affects neurotransmitters like serotonin and GABA, which help with mood and anxiety. Inflammation rises due to labor and delivery and tissue healing, which increases this inflammatory signaling and the brain's stress response and emotional regulation. You have disruptions in GABA, dopamine, and serotonin that can be reduced, that leaves the brain wired for worry, sadness, hyperalertness. For weeks to months, you could just feel completely overwhelmed, even if you thought you were prepared, and your body and brain are just literally on a roller coaster. So step 1 is looking at our hormone and neurotransmitter. So after delivery, do you know that estrogen and progesterone drops 50 to 70% almost overnight, and cortisol regulation can become erratic? These hormonal shifts reduce our serotonin and GABA signaling, which causes this mood dysregulation and this feeling of hopelessness. So there are some gentle lifestyle interventions that can help to stabilize hormones. Very short walks or just staying outside, light resistance over time. Stress management. Some nutrients are things like magnesium glycinate, B complex vitamins, and vitamin D to help support neurotransmitter and hormone balance. Step 2 is sleep deprivation and circadian disruption, because newborns often mean, fragmented sleep and constant nighttime awakenings. So sleep loss dysregulates cortisol, melatonin, and other hormones that control the mood, energy, and stress resilience. And exhaustion actually will leave the nervous system hyperactive with more anxiety and depressive symptoms as a result. So actionable steps are: when the baby sleeps, that's when you sleep. Keep nighttime lights dim to protect melatonin at night. Look at blackout curtains. Avoid overstimulation before bed, and accept support. It's very hard, but accepting support can, like someone holding the baby or helping in those ways, can be dramatically different. Inflammation. So postpartum inflammation can result from labor, healing tissues, infections, and stress. And these activated immune cells release inflammatory chemicals that can actually cross the blood-brain barrier, that interfere with mood regulation, anxiety, and reduce our body's ability to handle stress. So you want to look at anti-inflammatory foods, leafy greens, colorful vegetables, fatty fish, turmeric, olive oil, gentle movement, and hydration greater than 64 ounces, about 64 to 100 ounces, minimizing refined sugar as well as any inflammatory triggers. Step 4 is our gut health. So gut and nutrient deficiencies will amplify anxiety postpartum. The gut produces neurotransmitters like serotonin and GABA, and it's also poor gut function is linked with low mood and anxiety. So we want to look at magnesium, B12, iron, zinc, these nutrient deficiencies that can help with energy metabolism. You want to remove foods that worsen gut symptoms. You want to support digestion with probiotics, particularly lactobacilli and bifidobacterium for pregnant or post-pregnant women and for infants. Leafy green legumes, seeds, nuts, lean proteins are also critically important. Step 5, for nervous system regulation and stress management. The nervous system is in overdrive from hormonal shifts, sleep loss, and also caregiving demands. The amygdala, which is used in our fear and stress response, actually becomes overactive. The prefrontal cortex function diminishes, which helps with our decision-making ability. Anxiety, worry, and overwhelm spike. And so things that you want to look at are gentle grounding, deep breathing exercises, meditation, short walks outside. I like to call what's micro moments of mindfulness, 1 or 2 minutes, and connecting with supportive partners and friends. So if we just summarize, what are some basic supplements and overall support to help reduce postpartum depression and anxiety while breastfeeding safely? So you want to look at supporting the hormones and neurotransmitters, as I mentioned, magnesium glycinate, vitamin D, B complex, prioritizing sleep and looking at sleep patterns and circadian rhythm, reducing inflammation by way of movement. Sometimes lymphatic massage is also helpful, anti-inflammatory foods, probiotics like lactobacilli and bifidobacterium, and then also regulating the nervous system through grounding, mindfulness, mindfulness, and deep breathing. Now, there are some optional, generally safe supplements that have been studied and looked at while nursing, and those include things like omega-3 fatty acids, which are rich in EPA and DHA, which are also anti-inflammatory. L-theanine in small amounts promotes calm without sedation. Turmeric is also a gentle anti-inflammatory. Ashwagandha in low doses may help with stress, but you always want to confirm with provider if you are breastfeeding. So even small, consistent steps, so small steps I always say are huge in helping your brain and body stabilize, and can also help to maintain, as a result, anxiety and depression from feeling less overwhelming, so you can actually enjoy motherhood fully. If you're a new mom struggling with postpartum depression or anxiety, remember you're not broken. Your brain is recovering from these massive changes, and with the right support, calm, and clarity are possible. If this video helped, please subscribe for more science-based strategies to restore mood, energy, and confidence postpartum. And if you know a new mom like myself who's struggling, please share this video, because understanding the biology of postpartum mood disorders can be life-changing.